In this video, we are going to see what are the drug supplements necessary during breastfeeding, and we are also going to discuss about what are the drugs needed to avoid and what are the food needed to avoid during the breastfeeding. So let's get started. Is there any drug supplement needed during the breastfeeding? In general, most breastfeeding mothers do not require drug supplements to support milk production and maintain their health. However, there are certain situations where a healthcare professional may recommend taking supplements or medication to support breastfeeding. Here are some examples. First, iron supplements. If breastfeeding mother is experiencing iron deficiency anemia, a doctor may recommend iron supplements to help restore iron levels and prevent complications. Then vitamin D supplements. Breastfeeding mother and their babies may have higher risk of vitamin D deficiency, especially if they are not getting enough sunlight exposure. A healthcare professional may recommend vitamin D supplements to help support bone health and overall wellness. Probiotics. Probiotics may be recommended to help support digestive health and immune function in breastfeeding mother and their babies. Next is galactogogues. Galactogogues are medications or herbal supplements that are believed to help increase milk production in breastfeeding mothers who may be experiencing low milk supply. Some examples of galactogogues include domperidone, fenugreek, and blessrethistil. Fenugreek and blessrethistil are the herbal medicine. There is no problem, you can add it. But in the case of domperidone, it is the drug which is used for vomiting, preventing vomiting, and it should be used cautiously because it will promote the galactogogues action based on the increasing the level of prolactin hormone. So by the time it will increase the milk production, so it must be used with the doctor's advice. Okay, next we will see the any medication must avoid during the breastfeeding. Yes, there are medications or drugs that should be avoided or used with caution during breastfeeding, as they can pass through breast milk to the baby and potentially cause harm. Some medications that may be contraindicated or require caution during the breastfeeding includes: first, chemotherapy drugs. These drugs can be harmful to the baby's developing immune system and should be avoided during the breastfeeding. Secondly, some antibiotics. Certain antibiotics such as tetracycline and fluoroquinolones can cause discoloration of the baby's teeth and should be avoided during the breastfeeding. Third, antidepressants. Some antidepressants such as selective serotonin reuptake inhibitors can pass through the breast milk to the baby and may cause adverse effects such as irritability, difficulty sleeping, and poor feeding. Number 4. Codeine. Codeine is converted to morphine in the body and can be harmful to the baby, especially in those with genetic variation that cause them to metabolize codeine slowly. It is important to note that codeine is no longer recommended for use in breastfeeding mothers in the United States. Remember that this codeine phosphate is a normal ingredient in the cough syrups. So you need to be careful with the codeine. The next is the herbal supplements to avoid during breastfeeding. Certain herbal supplements such as sage and peppermint should decrease milk supply and should be used with caution during the breastfeeding. Okay, now we will see, is there any food should not be consumed by breastfeeding mother? Yes, there are some foods that should be avoided or limited by breastfeeding mothers. Here are some examples. First, alcohol. It is recommended to avoid alcohol while breastfeeding or limit consumption to 1 drink per day. Second is caffeine. High levels of caffeine can be passed through breast milk to the baby and may cause irritability and or sleep disturbances. It's recommended to limit caffeine intake to no more than 300 milligrams per day, approximately 2 to 3 cups of coffee. Then, fish high in mercury. Fish that are high in mercury, such as shark, swordfish, king mackerel, and tailfish, should be avoided as they can be harmful to the baby's developing nervous system. And then raw and undercooked meat and eggs. These foods may contain harmful bacteria and should be avoided to reduce the risk of foodborne illnesses. Spicy or heavily seasoned foods. These foods may cause digestive upset in some babies. Okay, this is about the drug supplementation recommended for breastfeeding mother, and also what are the food and drug needed to be avoided during the breastfeeding. So thank you very much for watching the video. If you like the video, the content, please do subscribe our channel and click the like button. Thank you.